Imagine not knowing where your job will take you next, or when, and not knowing who will need your help. A call that seems minor can turn out to be life-threatening. It might mean delivering a baby, or delivering news of a death to a family. Now do your job 52,000 times a year. That's every 10 minutes. 100 doctors and nurses could not be there in the street today, but you are there. Your hands are the hands that start the IV, give CPR, and reach out to hold theirs. You're a paramedic for the Hennepin County Ambulance Service. Somewhere, every 10 minutes.
Broadway, Monroe, code 3, PI, cyclist hit. Ticket 33165.
When a call is initiated through 911, a first responder would get the call initially. This could be either police or fire. Typically in Hennepin County, their average response times are within 2 to 4 minutes, and they can start basic life support at that time. The average response time for Hennepin County Medical Center ambulance service in Hennepin County averages about 6 minutes. So we're there shortly after the first responders, and sometimes we're there at the same time.
Hi, what do you got? Her name is Rhonda Skizik. Yeah, all we can get is 120 over Palpated. That's okay. We got there. Okay. Hi, Rhonda. How you doing? What hurts? As we get the board. Yeah. Did you fly over the hood of the car? Did you hit did the front of the car hit you and push you down? You don't remember, huh? You hurt up here in your hip? Put this arm up.
I'm just gonna kind of hold your head here, okay? We're gonna roll you onto your left side.
Let's roll over this way. Come down at the board just a bit.
No, that's good.
Okay. Let's roll you back.
Let us move you, okay? You ever gone to a hospital in the area? Does your neck hurt you at all? Okay. Do you know what hospital you would go to?
Yeah, okay, ready. Pull out that coach. I got a hold of her mother. Hold on. Did you call? She's going to General? Yeah. Mother? Yeah. Okay.
You become a medical detective of sorts when you arrive at a scene, and you might have to look for pill bottles, or you might have to look for the mechanism of injury of the trauma that you see, and sometimes it's not readily apparent, and it takes experience and a trained eye to find out what really happened here so that you can report that accurately to the doctor.
The paramedics have an excellent relationship with the emergency departments throughout the whole West Metro area, in the whole county. Primarily, they call in by radio, provide an initial snapshot picture of the patient to the doctor, so the doctor knows what resources or what people to have available to take care of that patient. I think once the patient arrives, then the paramedics provide a more detailed report of what the patient has and what they saw at the scene.
110 pal. Pulse is 100 and irregular there.
What other medical history do you have? You have high blood pressure?
Hypertension.
Okay. Do you have asthma or emphysema? You diabetic?
Emphysema.
What's your last name, Leroy?
I had that,
Yeah, he does have a past history of bypass surgery. He's had several MIs. Also, he has a history of emphysema and hypertension. He has no known allergies. He takes nitroglycerin, digoxin, Lasix, Iserdil. We find him, he's alert, oriented.
We have to talk with doctors when we're out on the scene with the patient. We have a standing
operating procedures where we can do a certain amount of things with the patient on our own, and when we get to a certain point, then we have to call in and talk to a doctor to get further orders or any further advice. Here it comes. All right.
On my way to,
Do you want to get his pressure over there while we're... Got right there.
San Diego. They took me off the bus. When I hit San Diego, the paramedics were waiting for me. I thought I didn't think I was going to make it that time.
When was your bypass surgery?
I had that San Francisco. That was a little over 4 years ago. Yeah.
A lot of people think that because we are Hennepin County Ambulance, they assume that that's the only place that we go, and that's not the case. We will go to the hospital of the patient's choice, unless if it's an emergency where time is of the essence and they need to go to a closer hospital or a hospital that has a higher critical care level. We will be in contact with the doctor, and if it's their decision that the patient needs to go to a closer hospital, then we will go to that closer hospital. Okay. Do you know what happened?
Oh, the car hit him. I just stayed.
The two brothers played ball, and the boss is, let's go to the street, and he tried to catch the ball.
Okay. Did you see him get hit by the car?
No.
He didn't. Only kids outside, so nobody on the right side.
Oh, we take him over to the ambulance. What's his name?
Lucky.
Lucky? Okay. This one? Did he come running to the house then? Here. Tell you what. He said he heard in here?
Yeah, and
The witness said that the car hit him, knocked him down, and then left.
Look at what we have. Look what we have.
How'd you like to have that? You want to hang on to him?
Here.
Okay, you take care of him, okay?
You might need a couple stitches. Huh? Can you ask him if his neck hurts at all?
Just relax.
Okay. The shoulder. He's got an abrasion on his. Does that hurt?
71 code 3.
No, nothing hurts.
No. Tummy?
Down here?
Lucky Jack, huh? Not so lucky today.
Yeah. You can't be lucky all the time. Has he ever been to the doctor? Has he seen a doctor? Like for a checkup at all? Where they've taken his blood pressure? What's he saying? That hurts, yeah. It's going to be kind of snug. It's okay, Lucky. How old are you, Lucky?
Can you hold up fingers? This many?
Oh, it's going to be snug just for a minute. Yeah, it's going to be kind of snug.
he's scared to have surgery.
Yeah, well, don't be afraid. The doctor's just going to take a look at that, kind of clean it up. Maybe give you a Band-Aid. Huh?
Has he ever had stitches before?
No.
Yeah.
He may not need them, but they'll clean it up.
Maybe
Opposed
they'll take him to Children's.
Has he ever been to Minneapolis Children's?
No.
No?
But
Okay.
we should go over there because the
Yeah, because they're a children's hospital. Okay. So children's?
Children's, okay. Tell the
In Hennepin County, all 911 calls are treated as an advanced life support call initially. That is to say, an advanced life support ambulance is dispatched with 2 certified paramedics. We always appreciate when we're driving down the road and with lights and siren on and people yield the right of way. So we try and drive defensively at all times, but we really appreciate it when people do yield the right of way to us.
Hi. Good, how are you?
Hi.
Yeah.
Oh, make sure that you come with. Don't get scared. Yeah, that's understandable.
I think it's a combination of having a good county system with good county support. The other thing that's really helped is that there's a combination of private and public hospitals that provide the definitive care. So the paramedics know that once they've stabilized the patient or they're able to transport, they have someplace they trust to take the patient.
He's got a laceration on his head here.
All right.
And he's also got an abrasion on his shoulder right in there. And that's the only thing he's complaining about. He denies any neck or back pain. He's moving everything around.
I mean, they are professionals, and they provide a service that no one else is trained to provide. And I think that that gives them the good pats on the back and the recognition. I don't know if the public, unless you're in a situation where you need a paramedic, you don't think very much about them. It's just like anything else. If you've never had a heart attack, then you're not worried about who your cardiologist is going to be. But once people are able to make a contact with the paramedics, they realize what a valuable service it is.
There is a lot of downtime between calls, and we spend a lot of time in the ambulance where we're actually sitting in the ambulance. I like to bring a book to read or something. Or certain times during the month, we get called quite often to what are described as one down, where it's actually a person laying, they may be laying in the bushes or along the road or something. We'll get there and we end up having to rouse people, and usually there isn't anything medically wrong with them other than that they're intoxicated. And we have to make sure that they are okay, and if they do not have a place to go or can't get up, then we either have the police transport or we will transport them to the detox center. But we do get a lot of calls for one down.
So let it go.
See if he goes. Just making sure he doesn't lie down again.
Our job, as it were, is to receive incoming calls both from public service agencies, specifically police department, sheriff department in western Hennepin County, as well as the 911 system over in the courthouse. And what we do is we receive the calls, and based on the nature of the calls, we'll dispatch the appropriate ambulance and dispatch them appropriately in terms of Code 3, lights and siren, or routine response. And I think that there's a willingness amongst the people that work here for Hennepin County, especially in the ambulance service, to do the best job that they can and go the extra mile if they have to for the patient's welfare. I really believe that.
Many of our calls are given to us by the dispatcher as a assault, possible domestic.
She's in the Valley Women's Shelter now.
Can I get your name?
Deborah Paul. She's more than welcome to stay here,
You don't have any cuts in your fingers or anything where the blood could have...
Very often when we arrive at the scene, the assailant may be already in custody.
Okay, do you want to go to the crisis center and talk to somebody?
I had called Women's Advocate and explained it and what's going on, and she told me that whenever I got myself together to come back, I already put out an order of protection on him, so what's that?
And in those cases, you have to try and give them the information of a safe house, or that they can come down to the hospital and go to the crisis center and be given some other alternatives for their own protection and for the protection of their children.
I really need to see him. Oh, come on.
Okay.
Yeah. I'm just sick of this.
Next time you see him.
I'm tired. I've been through this for years.
Now do your job 52,000 times a year. That's every 10 minutes. You're a paramedic for the Hennepin County Ambulance Service. Somewhere, every 10 minutes.